Welcome to Session 2 of the Living Successfully with a Mood Disorder course. In this session, we're going to be focusing on the types of treatments that are available for depression and bipolar disorder. Often when a person says treatment, people immediately think of medications. While for many medications can be very beneficial, there are many additional treatments available. We will specifically talk more about peer support and some of the great wellness tools out there to help you along the way. When we're talking about treatments, we feel it's important to start with a good understanding of the importance of partnering with your healthcare providers. A good healthcare provider pays attention to your needs, goals, and backgrounds. You and your healthcare provider should have a partnership in which you both have input and there is open communication. Long gone are the days where a doctor tells you what to do and you blindly take the recommendation. While your providers are experts in the field of mental health, you are an expert by experience. Be sure to ask as many questions as you find helpful and remind your provider of your overall goals for treatment as needed. DBSA recognizes that there are many paths to wellness and promotes numerous treatment components that are beneficial for an individual's achievement of recovery. We believe that a successful approach to mental health is balanced and starts best with a knowledgeable, empowered individual. A good treatment plan often includes medication or treatments to stabilize mood, talk therapy to help with coping skills, support from a peer-run group like DBSA to learn from and gain strength from others that share similar experiences, and a personal wellness plan that helps you better direct your treatment priorities and live better day to day. Medication is one of the most common treatments for mood disorders. However, some individuals find that they do not need medications, while others find them very helpful. There are many safe, effective medications that may be prescribed to relieve symptoms of depression or bipolar disorder. You and your doctor will work together to find the right medication or combination of medications for you. This process may take some time, so don't lose hope. Some common types of medications include mood stabilizers. These medications help balance your highs and lows. Some mood stabilizer medications are called anticonvulsants because they're also used to treat epilepsy. Antidepressants. These medications help lift the symptoms of depression. There are several different classes of antidepressants. Antipsychotics. These medications are primarily used to treat symptoms of mania. Even if you are not hallucinating or having delusions, these medications can help slow racing thoughts to a manageable speed. No two people will respond the same way to a medication, and many people need to try several before they find the best ones. Different treatments may be needed at different times in a person's life. Additionally, for some, medication's effectiveness may also change over time, so consistently tracking how you are doing can help. Keep your own records of treatment, how you feel each day, what medications and the dosages you take, and how they affect you to help your doctor develop a treatment plan with you. The printed DBSA personal calendar or online DBSA wellness tracker can be very helpful for this. Your doctor may start your treatment with a medication approved to treat mood disorders. He or she might also add other medications which have been approved by the Food and Drug Administration as safe and effective treatments for other illnesses of the brain, but have not yet been specifically approved to treat depression or bipolar disorder. This is called off-label use and can be helpful for people whose symptoms don't respond to traditional medications. Discuss potential side effects of any medication with your doctor and/or peers prior to taking the medication, and be sure to tell your doctor about any side effects that become problematic. In addition to medication, there are several other biological treatments currently in use that have been shown to help reduce symptoms of depression or bipolar disorder. In the 1930s, ECT was discovered when researchers learned that applying a small amount of electrical current to the brain caused small, mild seizures that changed brain chemistry. Over the years, much has been done to make this form of treatment milder and easier for people to tolerate. ECT can be effective in treating severe depression. However, there can be side effects such as confusion and memory loss. The procedure must be performed in the hospital with general anesthesia. In 2008, the Food and Drug Administration approved TMS as a treatment for depression for those who haven't adequately benefited from previous antidepressant medications. TMS works by using a special electromagnetic device that's placed on the scalp and sends short bursts of energy to the brain. These pulses of energy stimulate nerve cells in the part of the brain that's associated with mood regulation. TMS therapy does not require surgery, hospitalization, or anesthesia. The side effects associated with TMS, such as mild headache or lightheadedness, are relatively infrequent and usually go away soon after the treatment session. While TMS is approved to treat depression, it is not officially approved to treat depression in people with bipolar disorder. Vagus nerve stimulation, or VNS, involves implanting a small battery-powered device similar to a pacemaker under the skin on the left side of your chest. This device is programmed to deliver a mild electrical stimulation to the brain. The FDA has approved VNS therapy for people 18 years of age or older and those who are experiencing chronic or recurrent treatment-resistant depression. The treatment has been shown to be equally effective in both unipolar depression and bipolar disorder. The antidepressant effects of VNS tend to build up slowly and continue over time. The most common side effects of VNS are hoarseness, sore throat, and shortness of breath. Psychotherapy, also known as talk therapy, is often an important part of treatment for depression or bipolar disorder. A good therapist can help you cope with feelings and symptoms and change behavior patterns that may contribute to your illness. There's virtually no end to how talk therapy can help. It can help you understand your illness, overcome fears or insecurities, cope with stress, improve relationships with family and friends, and so much more. There are several different types of talk therapy. CBT, or cognitive behavioral therapy, is goal-oriented and works best when the patient takes an active role. One aspect of CBT helps a person recognize the automatic thoughts or core beliefs that contribute to negative emotions. The therapist helps the person see that some of these thoughts and beliefs are false or don't make sense, and helps the person change them. The behavioral aspect of CBT takes place after a person has a more calm state of mind. The person can then take actions that help him or her move closer to planned goals. For example, if depression has caused someone to withdraw from life, that person may be encouraged to participate in hobbies or spend time with friends. Or a person may be gently coached, under supervision, to confront situations, things, or people that cause fear or panic. Through practice, a person learns new, healthier behaviors. DBT is a form of cognitive behavioral therapy. The therapist assures the person that their behavior and feelings are valid and understandable. At the same time, the therapist coaches the person to understand that it is his or her personal responsibility to change unhealthy or disruptive behavior. The therapist consistently reminds the person when his or her behavior is unhealthy or disruptive, when boundaries are overstepped, and then teaches the skills needed to better deal with future similar situations. Oftentimes, DBT involves both individual and group therapy. Interpersonal therapy is time-limited and goal-oriented and addresses a person's symptoms, social relationships, and roles. IPT focuses on what is happening here and now and attempts to help a person change rather than just understand his or her actions and reactions. It looks at conscious outward action and social adjustment. It does not try to change the personality, but rather to teach new skills that can lessen symptoms. Family-focused therapy works to identify difficulties and conflicts among family members that may be worsening the person's illness. Therapy is meant to help family members find more effective ways to resolve these difficulties. The therapist educates family members about their loved one's mental health condition and how to help their relative manage it more effectively. FFT also focuses on the stress family members feel when they care for a relative with a mental health condition. The therapy aims to prevent family members from burning out or disengaging from the effort. Often the person experiencing the mental health condition will attend sessions with family members. When people who have had similar experiences with mental health conditions give each other encouragement, hope, assistance, guidance, and understanding to aid in recovery, it is called peer support. One of the most helpful things one person can say to or hear from another is, "I've been there." Peers coming together, sharing experiences, and mutually gaining hope and support from one another is the foundation of peer support. Peer support can take many forms and can be either informal or formal. We're going to talk a little bit more about one particular form of peer support, DBSA support groups. DBSA chapters offer more than 700 free, peer-led, and publicly accessible local support groups throughout the U.S. Together, these groups are visited by over 50,000 people every year. DBSA support groups provide support and education for depression and bipolar disorder. They offer regular meetings to share and learn from each other's experiences, and they provide a safe, confidential place for people to openly share feelings and concerns. And possibly the most important, they focus on wellness rather than illness. You can find a DBSA support group near you by visiting dbsalliance.org/findsupport. As we touched on in the last session, one part of treatment that is very important to many is their personal wellness strategies. Personal wellness strategies include anything that you do that help you feel better or more balanced in your life. Some examples include meditation, taking a walk, journaling, eating a balanced and varied diet, getting enough quality sleep, participating in artistic expression, taking a hot bath, doing crafts, playing with a pet, volunteering. Pause the video and jot down some personal wellness strategies that work for you or that you'd like to try on page 5 of your plan. You may also wish to complete page 6, which gives you an opportunity to think about things that may get in the way of you completing your wellness strategies and what you might be able to do to deal with this interference. Some of your personal wellness strategies may include things like keeping track of your moods or getting peer support. DBSA has several tools that can be helpful as you work towards wellness. Knowledge is power. On dbsalliance.org, you'll find in-depth information about depression and bipolar disorder, treatment options, strategies for better communicating with clinicians, family and friends, and much more. Arm yourself for success by learning as much as you can about mood disorders and your options. DBSA's printed personal calendar and online wellness tracker can help you keep track of your moods day to day, as well as tracking life events, exercise, amount of sleep, and much more. These tools can be great to help you keep track of how you've been doing. Many people find it helpful to share these reports with their mental health care providers to show what's been going on with them since their last appointment. The personal calendar can be downloaded or ordered from DBSA's website, and the online DBSA Wellness Tracker is available at facingus.org or by downloading the app on your iPhone or Android device. Facingus.org is DBSA's wellness clubhouse. In addition to the DBSA Wellness Tracker, it has many other great wellness tools you can use. In the clubhouse, you can create a personalized wellness plan, maintain a journal, share wellness tips with your peers, and listen to or watch audio and video recordings of meditations and yoga, find inspiration in the personal video stories of other individuals who live with mood disorders, and much more. And as we talked about earlier, DBSA support groups can be a great way to learn from others what wellness tools have worked for them. You may even find some people willing to try out some new wellness tools with you. As we wrap up this session, let's take a minute to try another wellness activity. Breathing is something we all take for granted, but slowing down and focusing on our breath offers countless benefits to both our mental and physical health. There are many different types of deep breathing strategies, but one of the simplest is to sit in a chair with your back straight and arms on the armrest or in your lap. Take a deep, slow breath in through your nose that lasts close to 5 or 6 seconds. Then hold for a few seconds and breathe out slowly through your mouth, taking close to 7 seconds. It can help to breathe out like you're whistling, and repeat it 10 times. Let's take a minute to do that together. Take a deep, slow breath in through your nose, and breathe out. If you think this may be a wellness activity you want to use, there are a few iOS and Android apps available on your phones and tablets that can help you practice. Thank you for joining us for Session 2. If you wish, you may now move on to Session 3.